everyone, welcome back to my channel. So today I wanted to talk about what stiff person syndrome is. I did do a video on my journey with stiff person syndrome, but it was mostly talking about how I arrived to my diagnosis. And it was quite a long video, so I decided it would be a good idea to just do an informational video, just letting you guys know what stiff person syndrome is. So stiff person syndrome is an autoimmune neurological disorder that causes rigidity and spasms in the limbs and the trunk. So basically arms, legs, and kind of like your thoracic area. So the symptoms are muscle stiffness. I guess like your muscles don't feel as pliable as they did in the past, but also episodes of violent spasms, that are typically, they can be triggered by environmental things. So loud noises, like if you get scared of something, those types of things. Maybe a lot of stress can also trigger spasms. And so this, because it affects your arms and legs, it can cause difficulty walking, falling. Falling is very common with SPS. Obviously trouble using your arms, and then you can't do anything that you need your arms for, which would be like probably driving a car, maybe even eating, that type of thing. So it can be a very, very disabling condition. Other symptoms of SPS are anxiety and depression, and there's sort of a little bit of debate as to whether SPS itself causes anxiety and depression, like that's a symptom of it, or because it's so disabling, people become anxious and depressed. A lot of people develop agoraphobia because they're afraid to leave the house because they don't know if they'll have an attack because of all the outside stimulus. So a lot of people become agoraphobic, and again, that's sort of like an offshoot of anxiety. So how do you get diagnosed for this? So this is where it becomes very tricky. It's very difficult to diagnose stiff person syndrome. Contrary to what some doctors will tell you, it is very hard to diagnose. You need to have a positive anti-GAD antibody test. So GAD is glutamic acid carboxylase. It helps to make GABA, and GABA regulates motor neurons by decreasing their activity. So if you have something attacking your GAD antibodies, then you're not going to be making enough GABA, and I guess your motor neurons are going to be overly stimulated, and that's where you get the muscle spasms and the stiffness and all of that. And I believe GABA also helps with anxiety and depression. So if you're not producing GABA, that obviously would lead you to have issues with anxiety and depression. I believe that's sort of the theory behind why SPS is associated with anxiety and depression. People with SPS are also more likely to have other autoimmune illnesses like diabetes, and I think vitiligo, a few other autoimmune illnesses there. There is a rare form of, SPS is a rare condition, which means it affects less than 1 in 1 million people. There's an even rarer form that is known as a paraneoplastic type of stiff person syndrome that's associated with amphiphysin antibodies. I don't want to get too much into that one because that one is associated with cancer. So I feel like that would require its own separate video. I just want to specifically focus on the anti-GAD SPS. Now, as I mentioned, it's very difficult to diagnose because up to 30% of people with SPS are not going to show anti-GAD antibodies. I'm one of those people. I did not test. They tested my GAD levels. It was nothing. The other issue is that the titer of anti-GAD antibodies does not always correlate with your disease activity. What does that mean? the number, like how high your anti-GAD antibody levels, does not indicate how severe your illness is. It says it doesn't always correlate. So it does correlate sometimes, but not always. So there might be somebody that has like, crazy high level, like 100 or something of anti-GAD antibodies, but they have mild stiffness. And there might be someone that has like very low antibodies, like 5. I've actually seen that because I'm in the Facebook group for people with SPS, where they'll say that they have like a 3 or a 5 or something, but they have very severe spasms to the point where they can't walk or they can't even work anymore. So that's one thing that has been observed, is that it doesn't matter, because usually your antibody levels, right, the how high or low they are will indicate how severe your disease is. And for whatever reason, with stiff person syndrome, they don't always correlate. And like I said before, 30% of us don't even have the GAD antibodies. We don't even show them on the tests. There are some people that say that if you keep testing for it, eventually they do show up, that for whatever reason the test doesn't show them very well, or they just kind of pop up randomly. I don't know how true that is, but I have heard that's, there's some people that have tested and tested and tested, and eventually they pop up with the antibodies. I actually tested positive for the amphiphysin antibodies, which are associated with cancer, but because I didn't have cancer, they told me it was a false positive. They retested me for those antibodies, and I never tested positive again. I think that is very, very, very suspicious and very strange. But about 99.9% of the time, those antibodies are going to show up with some type of cancer, like breast cancer, ovarian cancer. And speaking of cancers that affect women, I believe stiff person syndrome is much more likely to occur in women. I think it's kind of like 3 to 1 or something like that. So if you're female and you're having some of these symptoms, could be likely. And I believe the onset of this condition is between the ages of 30 and 60, which is kind of a big range. I guess you can just say it's an adult onset condition. 30 and 60 is like, that's a huge range. So the treatment, and again, much like the diagnosis, it's very difficult to treat. From what I have personally seen in support groups, on message boards, there are some people that respond very well to treatment, but there are a lot of people that just don't, and they try treatment after treatment after treatment, and they just it doesn't help, or they sort of develop a tolerance. So one of the first line of treatment for this condition is actually benzodiazepines, also known as benzos, also known as like Valium, Xanax, which, diazepam, those types of drugs. As you know, or as many of you probably know, these are highly addictive. So that can become a problem. They're highly addictive, and I think you can build a tolerance to them. And so that can make treatment difficult, because, if you develop a tolerance, eventually you need a higher dosage. And then getting off of them is also pretty difficult. And I believe you can also have like a rebound effect. Your symptoms come back a little bit more aggressive when you're trying to get off of them. There are also muscle relaxers like baclofen. There are some people that have pumps installed. I've heard of baclofen pumps where it pumps medication at certain intervals. That way you get a steady dose of the medication. And again, I'm sure there's tons of side effects to that, but there are some people that can only live, and exist and function with that medication. Steroids, obviously steroids are used a lot with autoimmune conditions and also carry lots of side effects. And there's also IVIG, which is the drug that I'm on. And I'm considered a mild case of stiff person syndrome, which again, I guess because I don't have those intermittent spasms that are incredibly painful, my doctor classified me as mild. but my muscles went stiff and they never came out of that stiffness, which, you know, which sucks because I never get a break from the stiffness. It's just there. It's almost like it became permanent. It's not super disabling, but it's still not great. And so she was concerned about putting me on benzodiazepines because of their addictive qualities. But IVIG is incredibly expensive. And if you haven't watched my other video of my SPS journey, you might want to watch that because it's very difficult to get IVIG prescribed. Took me about 4 years fighting with doctors, and being referred from one doctor to another until I finally ended up at UCLA, and my doctor prescribed me. She actually asked me, she said, "Do you want IVIG?" And I said, "Look, I'm not the doctor here, you are. But yes, my preference would be IVIG because I had previously had a positive response to it. That was how I came to the conclusion that I had SPS, is because I had been on that drug previously for something different. IVIG is basically, it's used for immune deficiencies, but it's also used in autoimmune conditions to regulate your immune system. So basically, your immune system's kind of like this, and it sort of brings it back to neutral. Am I cured? No. Am I better than I was? Yes. But my symptoms have not completely resolved. And one of the last treatments is called plasmapheresis. I think that's how it's pronounced. And that's basically where they take your blood out. It's almost kind of like, I guess, a type of dialysis where they hook you up to a machine. They take your blood out and they separate the plasma and the cells, I guess, to sort of get rid of the autoimmune antibodies, and then they reinfuse you, I guess, with your plasma or something, minus the antibodies that are causing your condition, and that's supposed to help get rid of the stiffness and that kind of thing. Also kind of dangerous. I think one of the major complications from plasmapheresis is your blood pressure dropping, and if you're someone that already has low blood pressure or has blood pressure issues, it can be kind of dangerous. I mean, removing a large volume of fluid and blood from your body is always kind of dangerous. So, I mean, I probably don't even need to explain why it's dangerous. Other things that can help are physical therapy and like aqua therapy, I guess, moving around in a pool. In my experience, physical therapy has been a pretty big help. Again, it doesn't make the stiffness go away, but it does help to keep the surrounding muscles, a little bit more pliable so that the stiffness does not feel as bad. I haven't gone to physical therapy in a long time because of the pandemic, but I do have stretches that were prescribed to me many years ago that I have religiously kept doing for many years. And I do them every day. Unless I really don't feel good, I do them every day, because as soon as I stop, I notice that all of my muscles become less flexible. And obviously the stiff muscles, you can only do so much, but the rest of my body also seems to kind of become less pliable, and that makes discomfort even worse. Water therapy, we do have a pool here at my house, and in my experience, it can make my symptoms worse. And that brings me to the next, the final point of what makes stiff person syndrome worse. As I mentioned before, environmental stimuli, loud noises. I think even light, like bright lights and stuff, can also, I think it really depends on the person. This disease varies a lot from person to person. So, for me, I have not noticed that bright lights or noises or getting scared of things affects my condition. I haven't noticed it. I mean, maybe it does. And I also don't have that intermittent spasms. I just have the muscle stiffness that happened and never went away. But in my experience, stress has always been associated with the onset of my symptoms. So when my pelvic floor went stiff, I was in college and I was under a lot of stress because I think I was in my final year of school. And obviously it was very stressful because I was going to graduate, and I had to work. I had to, I had finals. It was my last year in school, and I was trying to get my degree. And then suddenly I had this thing happen. And then I think with the thoracic stiffness, I was working. I got my first full-time job. It was many years later because I had still been struggling with the pelvic floor issue. And suddenly I got my first full-time job, and I was like finally a responsible adult. I was living on my own. I had gotten kicked out of my house. So I got an apartment. I was living with my boyfriend at the time. And sure enough, within a few months, the stiffness spread to my trunk area. So stress has always been a huge trigger for me. Strengthening exercises. Now, I did talk about stretching. Stretching helps. Strengthening makes it worse. And this is also kind of like a telltale sign that you might have SPS. And that's if you do strengthening exercises, for example, lifting weights, doing crunches, sit-ups, things like that. If it makes the stiffness worse, it's likely stiff person syndrome. And I was nagged, within an inch of my life by my ex-husband, by my physical therapist. They would tell me, you need to strengthen these muscles because if you don't strengthen them, they're never going to get better. And I kept saying, when I do strengthening, it makes it worse. If I do sit-ups, my trunk gets stiffer. It doesn't get better. If I did a lot of pelvic floor work and exercise, and I look back and I can't imagine the amount of damage that I probably did to my pelvic floor by doing so much strengthening. And I would notice that when I would do strengthening, I would have more difficulty going to the bathroom. I would have urinary hesitancy, which means that you're not able to pass, urine and things like that because the muscles were becoming more stiff and less pliable. So I learned over time that stretching was better and strengthening was only going to make things worse. And finally, once I got my SPS diagnosis, everybody kind of left me alone. They were like, okay, we get it. You can't do strengthening because it's just going to make the situation worse. And like I said, this is more common in women than men, but there are plenty of men that do have SPS from what I've seen. But I guess I believe autoimmune conditions in general are more common in women than in men. So that can be a risk factor. And of course, they are the more rare paraneoplastic form of SPS is associated with like breast cancer and ovarian cancer. So there's also that. So that is what stiff person syndrome is in a nutshell. And I definitely needed to make this video because, talking about my own personal experience is one thing, but giving the rundown of this very rare condition, and again, these are not hard and fast symptoms or rules to this condition. From what I have seen and from other patients that I've talked to, it varies widely. I remember seeing one lady in a Facebook group that had cirrhosis of the liver. She had never drank in her life. She never did drugs, nothing. It was just an unfortunate, I guess, side effect of having SPS. And I have seen many people with SPS with all of these weird other symptoms, other autoimmune conditions, strange things like cirrhosis that are not associated with anything that they're doing. And I have met, I believe, 2 others that were previously diagnosed with Lyme disease and then ended up having the GAD antibodies and then getting diagnosed with stiff person syndrome. Like I said, I don't have GAD antibodies. I think I've seen other people that don't have GAD antibodies or their GAD antibodies are really, really low. And they're just like super disabled and on a lot of pain. So if a doctor tells you you don't have anti-GAD antibodies, and I did have one neurologist tell me that, that does not rule out the condition. And if they're telling you that, also too, in order to, if you don't have the anti-GAD antibodies, ask for an EMG, which is, I believe, an electromyography of the muscles where they put the little needles in the stiff muscles. Ask for that, fight for that test. I did have it and they didn't find anything on the test because they weren't putting it into the stiff muscles. They will give you a hard time because a lot of times they don't want to diagnose it because the treatment is very, very difficult to get. IVIG is very expensive and insurance does not want to cover it. But there are other tests, but typically it's almost like a clinical diagnosis. And I was fortunate that I had been on IVIG previously And I was able to tell the doctor, this is how my body reacted to this drug. And that's sort of how they put the pieces together. And only a person with this condition that had been on that drug would be able to tell you and to describe it to you. And so there's no way that I could have been lying to them. There's no way that I could have guessed that IVIG would have helped my muscle stiffness had I not been on it before. So again, these are the basics. There are Facebook support groups for stiff person syndrome. There's not many of us in there, but it has been a tremendous help. It is kind of scary. There's a lot of scary stories in there, but it has been helpful, especially when finding a doctor. I think that just go in there with caution, because a lot of people share very scary stories. If you are specifically looking to find a doctor, it's helpful. Go in there with that objective, and try not to pay too much attention to the noise, because it can be kind of devastating, to be honest. But that's what I have for you today. Thank you for joining me, and I will see you in the next one.